Welcome back to Blue Collar Retirement. In this series, we talk about retirement the way real people experience it, not with confusing jargon, but with straight explanations you can actually understand. Today, we're talking about Medicare. And for a lot of folks, this is one of the most confusing parts of turning 65. People hear about parts A, B, C, and D, supplement, advantage plans, enrollment periods, and pretty quickly it all starts to sound like alphabet soup. So let's slow this down and walk through Medicare simply. First, what is Medicare? Medicare is a federal health insurance program mainly for people aged 65 and older, and for some younger people with certain disabilities. It's not one single thing, it's a collection of different parts that each cover something different. Medicare began in 1965 under President Lyndon Johnson. At the same time, the Medicaid program also began. Medicare originally was a partnership between the federal government and private insurance companies. Medicaid is a separate program. It's also a partnership, but those partners are the federal government and state governments. When Medicare began, the federal government would pay 80% of the cost, and a private insurance company would pay 20% of the bill. Medicare is available to people who have turned 65 or people who have been on disability income for 2 years. Medicaid is a health insurance program for individuals who fall below a specific income level and available resources. There are several requirements to qualify for Medicare. For most people, they need to be 65 years old and need to have worked for at least 10 years. The foundation is Original Medicare, which is Part A and Part B. Part A is hospital insurance. It helps cover things like inpatient hospital stays, skilled nursing care after a hospital stay, and hospice care, and some home health services. Most people don't pay a monthly premium for Part A because they paid Medicare taxes during their working years. Part A does have a deductible. For this year, the deductible is $1,736. Part B is medical insurance. This covers doctor visits, outpatient care, preventative services, lab work, and medical equipment. Part B does have a monthly premium, and that premium can change based on income. For 2026, the cost is $202.90 per month. There's also a deductible that must be met. In 2026, that amount that persons must pay before the benefits actually kick in is $283. This cost per month can go higher for those with higher incomes. So, for example, a married couple that has an income of $218,000 annually will each pay a Part B of $284.10 per month. Now, here's something important that surprises a lot of people. Original Medicare does not cover everything. It doesn't cover most dental, vision, or hearing needs. It doesn't cover long-term custodial care, which includes the cost of a nursing home. And it has deductibles and coinsurance with no built-in limits on how high your out-of-pocket costs could go. At first glance, it appears that the program has a lot of cost for health insurance. That's why you'll hear about two main paths for people that they can take to fill those gaps. One path is Medicare Supplement, also called Medigap plans. These plans are offered by private insurance companies. These plans work alongside Original Medicare and help pay some of the cost Medicare doesn't cover, like deductibles and coinsurances. When Medicare began, the Medicare supplements were labeled Plan A. All Plan A's had exactly the same coverage. Insurance companies have the flexibility to set their price for a Plan A. Since then, there have been more than a dozen additional plans. Like a Plan A, each lettered plan has the same benefits. For example, Plan G has the same features no matter what insurance company is offering the plan. You can go to almost any doctor that accepts Medicare, and the coverage travels with you. across the country. The other path is Medicare Advantage, also known as Part C. These are plans offered by private insurance companies that replace original Medicare and offer a bundle of extra benefits like dental, vision, hearing, and prescription drug coverage. They usually have networks and copays more like the insurance you had while you were working. Medicare Part C was created in 1997. It was known as Medicare Plus Choice. The popularity of Medicare Part C plans began to rise when the HIPAA laws were added. Those are the privacy rules in 2003, and it took effect in the year 2006. Since 2006, Medicare Advantage plans have risen in popularity and now are more widely used than Medicare Supplement plans. There's also a significant number of people that are using neither a supplement or an Advantage plan with their Medicare coverage. The final piece is Medicare Part D. This expanded Medicare to cover prescription drugs. There are currently over 20,000 prescription drugs available in our country. This number includes both branded and generic drugs. In addition to prescription drugs, there are more than 6,500 medical device products. The challenge is how drugs are categorized and how they affect the coverage. The system is called a formulary. For example, many generic drugs are considered Tier 1 or Tier 2. The lower the tier, the lower the cost. Some drugs in these categories could have a zero cost copay. Cancer drugs can be in tiers 4 and 5 and have significant copays. When the Part D edition was added to Medicare, it included the infamous donut hole. There was a point when the coverage stopped and people had to pay the full cost. Once your out-of-pocket expenses rose to a specific level, you entered the catastrophic phase, and the costs were drastically reduced. Thankfully, the donut hole was phased out in 2025. Once you hit a spending cap, the catastrophic coverage kicks in. This cap is adjusted up each year. Medicare supplement plans do not include Part D prescription coverage. When you purchase a Medicare supplement or Medigap plan, you need to also purchase a standalone Part D plan. Many Medicare Advantage plans have Part D built in to their coverage. So you can see why people feel overwhelmed by all the moving parts of Medicare. It's not just sign up for Medicare. There are many questions that you should consider as you choose a Medicare plan. Important questions like, do you plan to live in a separate location throughout the year? Do you already have health issues that require a significant amount of health care? Let's talk about timing, because this is where many people make costly mistakes. Your initial enrollment period starts 3 months before the month you turn 65. It includes your birth month and continues 3 months after. That 7-month window is your main opportunity to sign up without penalties. If you're still working and covered by an employer plan, the rules can be different. Some people can delay Part B without penalty, others can't. It depends on the size of the employer and how the coverage works. Missing enrollment deadlines can mean lifelong penalties, especially for Part B and Part D. Those penalties don't disappear after a year. They can follow you for the rest of your life. Another thing people don't realize is that Medicare isn't free healthcare. Between premiums, deductibles, copays, and prescriptions, healthcare can still be a significant part of a retirement budget. That's why Medicare planning is really financial planning. Your choices affect more than just your medical card in your wallet. They affect your monthly expenses, your access to doctors, how you travel, and how predictable your costs will be year to year. And what works for your neighbor or your brother might not be right for you. Someone with a few prescriptions and great health may choose differently than someone managing diabetes or health conditions. Let's clear up a few common misunderstandings. Medicare does not automatically cover long-term nursing home care. It can cover short stays after a hospitalization, ongoing custodial care is generally not included. Medicare also doesn't cover everything overseas. If travel is part of your retirement dream, your coverage choice matters. And enrolling in Medicare does not mean you have to start Social Security at the same time. Those are two separate decisions, even though people often connect them. The big picture is this: Medicare is a foundation, not a complete house. You build on top of it based on your health, your budget, and your lifestyle. The goal isn't to pick the best plan in America. The goal is to pick the right plan for your real life, the doctors you see and the medicines you take, the places you travel, and the income that you live on. Most people spend decades working, saving, and planning for retirement, but only a few hours thinking about health coverage. Yet medical costs are one of the biggest expenses retirees face. Taking time to understand Medicare before you need it can prevent stress later, especially if health changes suddenly. If you're approaching 65, still working, retiring soon, or helping a parent navigate this, the best move is to start early, ask questions, and compare options before deadlines force your hand. Medicare doesn't have to be scary. It's just another piece of the retirement puzzle, like Social Security, taxes, and income planning. And when the pieces fit together, retirement feels a lot more secure. Thanks for spending a few minutes with us here on Blue Collar Retirement. Next time, we'll tackle another topic that real working families are facing as they need to move into retirement.
Safety first, retirement, ensuring your financial dreams.